Hi, I'm Dr. Rama Jagers. I'm a board-certified ophthalmologist and a retina specialist. I think one of the questions that a lot of people have is, what does a retina specialist actually do? I work on the retina, which is the back part of the eye. It's past the cornea, which is the clear part. It's past the iris, which is the colored part. I work on the retina, which is really the back part. And I work on the vitreous as well, which is the jelly that holds the eye in place. It's really a combination. It's called being a vitreoretinal surgeon, someone that works on the vitreous and the retina. What do I do every day? Well, I see patients that have retinal problems, such as macular degeneration or diabetic retinopathy or strokes in their eyes. Sometimes people have wrinkles in their retina. Sometimes people have a retinal detachment. And all of these conditions can cause profound visual loss. And my mission is to try to help people keep their vision so they can have a more meaningful life. How do we do this? Well, we use a lot of specialized imaging technology. The nice thing about retina is that there are a lot of really cool technologies to help image the back part of the eye. We take a lot of pictures of people's eyes. We have some pretty amazing machines that can actually detect the thickness of the retina and what is going on in the macula, which is the back part of the retina. And the macula is the part of the retina that allows people to see and read fine detail. In addition to that, we check people's visual acuity, which means we check how well they can see. We also then examine them using what's called a slit lamp, which is an instrument where a patient can put their chin in and a bunch of lights are shining in their eye in a very specific way to really help me examine the specific structures of the eye. And the eye is pretty complicated. There's a lot going on, and you really want to try to do everything you can to ensure that you're able to accurately diagnose someone with their problem. And the nice thing about ophthalmology and the nice thing about retina is that most of the things that you see on physical exam really kind of help give you a clear understanding of why a person is experiencing what they're experiencing. What do? We can give people injections of medicine in their eye. We call that an intravitreal injection. We can do laser treatments, so we can do what's called photocoagulation or gently burn areas of the retina that are causing issues. We can do surgery, so we can peel parts of the retina layers back. We can help aspirate or gently remove the fluid from behind the retina to help it reattach. Sometimes we put what's called a scleral buckle or a piece of silicone around the eye and suture it to help the retina stay attached. Sometimes we peel a layer of the retina off. And generally, that's pretty much what retina specialists do. Most of the things we're able to do now are in clinic, so we don't have to take everyone to the operating room. And it's certainly becoming more and more so that there are a lot more things that we can do in the clinic now as opposed to having to go to the OR. I've found tremendous satisfaction from trying to help people with their problems in the retina, and I'm proud to be a retina specialist.